Today, our discussion is devoted to the nation's health. Great medical facilities guarding the nation's health, the health of your family and mine. Research centers for the study of preventive medicine. Hospitals and clinics for the sick and disabled. Medical schools throughout the United States preparing our future doctors and dentists. We take for granted we are the healthiest people in the world, with full medical, rich or poor, with medical facilities second to none. This is one day, today, in the life of America. A 24-hour period across the length and breadth of the nation. Today, throughout America, 3,800 people will die, many of whom could have been saved by adequate medical care. Today, every 19 minutes, a baby will die, needlessly. Today, every 4 hours, a mother will die in childbirth, needlessly. Today, rural America, a call in the night for a doctor.
But I've got to have a doctor. My boys, where can I find a doctor?
Not in this isolated area where there is no doctor. This is America today, its cities, its towns and farms, where 1 out of every 6, 25 million of our citizens suffer from a chronic disability or physical impairment. The number of our handicapped children running into the millions. 37 out of every 100 draftees examined today rejected. Many because of preventable physical disabilities. 22 million of our citizens doomed to die of cancer. 9 to 10 million victims of heart or circulatory diseases. One day across the length and breadth of America.
How do you do? This is Willard Shelton, your Washington reporter. The state of our nation's health is something that concerns every one of us. Today, in order to explore this problem, we have with us Dr. Theodore Sanders, a member of the New York Medical Society and of the American Board of Internal Medicine, and a visiting physician in a voluntary and municipal hospital in New York City. Dr. Sanders, we have been seeing a few of the critical health problems which affect every one of us. Most of us used to think that Americans were rather healthy people. What is your viewpoint? Are the American people really a healthy nation?
I think that statistics show, Mr. Shelton, that the American people are as healthy as any other nation on earth. However, it is my feeling that we can do even better as far as health is concerned. For instance, you can't deny the selective service statistics, which showed that there were 4,200,000 4Fs. And of that number, according to Dr. Leonard Rowntree, 700,000 of them had a disease which could be cured, remedied, and made healthy again. I think that really answers your question.
In his day-to-day living, George Miller hadn't thought much about the possibility of sudden, serious illness, nor that his earning power might one day be cut off. Like his neighbors, like the great bulk of America's wage-earning population, George Miller makes a good deal less than $5,000 a year, an income which, according to government statistics, permits only one home visit by a doctor each year for each member of his family, but does not provide for the expense of emergency illness. For medical care in America is costly, where ward service in a hospital runs about $10 a day, the cheapest room between $12 and $15 a day.
You should have called me earlier, Mrs. Miller.
I tried to, Doctor. But he kept saying we couldn't afford it, but he'd get better.
You'll have to go to a hospital right away.
We don't have any money put by. Maybe my family could help. No. Dr. Robbins, what do people do?
What do people do? A familiar question among Dr. Robbins' wage-earning patients. With the cost of medical care rising yearly, with America's supply of hospital beds able to meet only half of our country's needs, with our shortage of doctors growing more and more acute, our medical schools accepting only 1 out of every 4 qualified applicants, turning out annually about the same number of doctors in ratio to our population as in 1910. With our increasing shortage of dentists, nurses, public health workers and public health centers, today with only a small fraction of our people living in communities where there is adequate public health services to meet today's health problems. What do people do, Doctor?
I'll see what can be done, Mrs. Miller.
It won't be charity, Doctor. He couldn't stand that.
We'll see.
Dr. Sanders, how does it happen that we have critical shortages in our health facilities?
Well, Mr. Shelton, let's take the doctor shortage, for instance. The universities just haven't got enough money to expand the facilities for turning out high-quality medical men. The United States government, in its medical aid program to medical education, tried to help the universities. But thanks to the American Medical Association, which spearheaded its opposition, the medical aid program was defeated.
Prescription for George Miller. 6 capsules of aureomycin a day for 10 days, but each capsule, even at cost, 40 cents, or $24 to fill the prescription. 1/3 of the family's weekly income, yet cheap compared to the cost of some other medicines.
And so we find today 75 million people are covered by some form of private health insurance. In the great majority of cases, unfortunately, not adequate as a guarantee of the future security and well-being of the American family.
Small consolation indeed for Mrs. Miller, whose husband is one of 75 million Americans not even covered by private health insurance. For George Miller gambled. The $5 a month he would have had to pay for a minimum type of protection for his family, he thought could be put to better use in food for his growing children. Would private health insurance have saved him? Ask Dr. Robbins.
The kind of health insurance most people can afford is barely adequate to take care of routine illness, much less serious emergencies, as in the case of George Miller. In 1950, the American people spent $4.75 billion for their hospital and doctor bills. Of that amount, only $992 million was covered by private health insurance funds. Over $3.75 billion was not covered by private health insurance. Now, we have no federal system of Social Security to take care of emergencies like these. For George Miller, this was too bad. In his case, there were 2 alternatives. Either the family go overwhelmingly into debt, or have him become a charity patient.
Dr. Sanders, what could have been done for George Miller and for other citizens like him?
Well, if we had national health insurance, and it were compulsory as Social Security and workmen's compensation, then George Miller would have been taken care of. He and his family would have complete, comprehensive health insurance. They would be able to pick out their personal physician. They could afford national health insurance because the employer and the employee pay 50-50. I think that if Miller were under national health insurance, not a catastrophe such as that could never have occurred.
But George Miller couldn't wait for Congress to act. When there was no other way out, he was taken to the charity ward of the municipal hospital. But it was already too late. But the state of the nation's health is not entirely dark. Today, America's labor unions are working vigorously toward the improvement of their members' health. Through health and welfare plans negotiated by such unions as the United Steelworkers of America, CIO. In clinics such as those established by the United Auto Workers, CIO. The Amalgamated Clothing Workers, CIO. Today, Veterans Administration hospitals throughout the United States provide medical care of thousands of veterans. Today, medical research has eliminated as killers once fatal diseases: smallpox, diphtheria, typhoid fever. Today, our death rate is the lowest on record. Our life expectancy now 68 years. But America must still face the stark realities of the future. Inadequate care for millions. A shortage of 42,000 doctors by 1960. 95,000 dentists. Thousands and thousands of professional nurses and public health workers. Conditions that threaten the future security and well-being of America's adult population and their children.
The CIO believes that the state of the nation's health is a matter of national concern, that the health of each one of us is a part of the nation's potential assets. Our talents and resources for combating disease should be shared equally, because disease strikes at each one of us equally, regardless of economic or social status. The very purpose of our national government is to solve national problems, including the health problem. Our representatives in Congress have a responsibility to solve the health problem for the benefit of our own health and the health of our children.